Hi friends, today we are going to work on Health Chapter 8, Lesson 3, Chronic Diseases. We are going to learn about chronic diseases, ways to prevent chronic diseases, and ways to show care, concern, and respect for people with special needs. Our vocabulary for today is chronic disease, allergy, asthma, diabetes, heart disease, and cancer. Carlos plays baseball. Carlos has a chronic disease. His disease makes his leg muscles weak. He uses a wheelchair to get around, but that doesn't stop him from playing baseball. Chronic diseases. You have learned that communicable diseases can be spread by objects, people, and animals. Some diseases cannot be spread. A chronic disease is a disease that lasts for a long time or keeps coming back. Asthma and allergies are chronic diseases. Heart disease and cancer are also chronic diseases. A child can be born with a chronic disease. The disease is passed to the child from one or both parents. Poor health habits can lead to some chronic diseases. You can lower your risk for these diseases by practicing healthful behaviors. Some behaviors that help prevent chronic disease include eating healthfully, avoiding tobacco, avoiding alcohol, getting plenty of physical activity, and getting plenty of rest. Allergies. An allergy is the body's overreaction to a substance. Substances that cause allergies are allergens. Allergens are substances that cause the body to overreact. Allergens include foods, animals, and plants. Allergens you breathe. Pollen is a powder from plants that can get into the air. Dust mites are tiny insects that live in carpets, mattresses, and dust. Dust mites and pollens may cause watery eyes, sneezing, and a runny nose. Allergens you touch. Poison ivy is a plant that causes an allergic reaction in some people. Dead skin from animal fur or bird feathers is called dander. Dander may cause watery eyes or a runny nose. Allergens you eat. Some people have strong reactions to some foods such as eggs, seafood, milk, and peanuts. These reactions include a rash, a stomachache, diarrhea, and difficulty breathing. Preventing and treating allergies. The best way to prevent allergies is to avoid allergens. Doctors called allergists treat people with allergies. They may use medicines or give shots to treat allergies. Asthma is a condition in which the air passages in the lungs become narrow. During an asthma attack, the person may cough, gasp for air, wheeze, or make a sighing sound. A person with asthma has an asthma attack only when near certain triggers. Some common asthma triggers are allergens, a very cold environment, and strenuous exercise. And here you can see the air passages during an asthma attack. They get smaller. After using the inhaler, they get bigger. Preventing and treating asthma attacks. The best way to prevent asthma is to stay away from triggers and people with colds or flu. People with asthma may use an inhaler. An inhaler sprays medicine into the air passages to make them wider. This helps people breathe more easily. Sometimes an inhaler does not ease an asthma attack. When this happens, medical treatment is needed. Diabetes. You get energy from food. When you eat, your digestive system changes food into sugar. Your blood carries this sugar to your cells for use as energy. Some people have diabetes. Sugar stays in their blood instead of going into the cells. Diabetes is a chronic disease in which there is too much sugar in the blood. People who have this disease must follow a diet low in sugar. Some must also take medicine every day to help their body use the sugar in food. People who have diabetes must test their blood often. A tool called a glucose monitor is used to test for sugar in the blood. A person can change his or her diet if the monitor tells that too much sugar is in the blood. Some people develop diabetes in childhood. Others develop the disease later in life. You can lower your risk for developing diabetes. 3 habits that lower your risk include following a healthful diet, getting plenty of physical activity, and staying at a healthful weight. And this is what a glucose monitor looks like. It tells the level of the blood sugar. Heart disease and cancer. Heart disease is a disease of the heart or blood vessels. Cancer is a disease in which cells grow in ways that are not normal. You can choose habits to help prevent these chronic diseases. Follow a healthful diet. You can get all the nutrients your body needs from a healthful diet. A healthful diet is rich in nutrients and low in fat. Fat can stick to your artery walls and block blood flow. If blood cannot flow through your heart, you may have a heart attack. A heart attack is a sudden loss of oxygen to the heart. Fiber is the part of grains, fruits, and vegetables that helps you have a daily bowel movement. This also helps prevent some cancers. Keep away from tobacco. Tobacco use causes heart disease. Nicotine in tobacco makes your heart work hard by narrowing your blood vessels. Tobacco also causes cancer. Harmful chemicals in smoke and smokeless tobacco cause cancer of the mouth, throat, and lungs. You can prevent these cancers by keeping away from tobacco. People with special needs. Some people have illnesses that result in a disability. A disability is not a communicable disease. A disability is a physical or mental condition that causes a person to have special needs. For example, a person with a spinal injury may need a wheelchair to move around. A person with hearing loss may need to use a hearing aid. A person with total hearing loss may use sign language to communicate. You can show care and respect for a person with a disability. Treat him or her the way you would want to be treated. You're as a person that's using sign language. So with your parents, I would like you to identify 2 ways you can get a chronic disease, list 3 sources of allergens, and name 3 triggers that can cause an asthma attack. You can write these questions down and then have your adults send them to me. I will see you guys later. Bye.